Welcome to the broadcast. You're listening to Knife After Death with Dr. Darin Wolfe.
Say, did you ever hear the saxophone let out an awful moan, let out an awful groan? It makes you feel so nervous, yet it's great.
Okay, welcome back to Knife After Death. This is episode 34, I believe. And this, is that right, Jesse? We're on
Yes.
episode 34?
Mhm.
Okay. And we've done one a week now. So I'm silently patting myself on the back because Jesse's kept me motivated to keep going because without somebody pushing me, I will fade into the ether. So I'm happy that we're doing it. And today's episode, we're going to get to that in just a moment. I do thank everyone for listening because I will tell you that our numbers are up. Lots of people listening compared to how it was before when I was doing it by myself. So thank you for that. Tell your friends, tell your family. And as far as we usually, the first thing we do is we talk about if there's any questions, concerns, confusion, or anything like that from our last episode or previous episodes. I personally did not receive any messages of anger or hate, or there was a little bit of praise, but we're not going to talk about that. But Jesse, I think there's something you wanted to talk about. Is that right?
Yeah, and
Yeah.
actually, obviously more so for you to explain since you're the doctor. However, one of the things that I think we both do in this industry, just by accident, because like this is what we do, this is our field. We use acronyms a lot. So, for instance, CBC, complete blood cell count, CMP, complete metabolic panel, things like that. I said in the last episode, the Frankenstein episode, where I was asking Dr. Wolfe if LPCs could be something that would cause, if it were to be able to somehow occur within the whole body, would be able to regenerate a person. LPCs are just an acronym for liver progenitor cells. I should have said it just outright, and then it'll be,
Yeah.
yeah.
Yeah, that's great. Yeah, and without going, I don't think we need to really go into a big science lesson there, but I think she's right that we do sometimes glaze over the fact that we're not always talking to other medical or forensic professionals, and acronyms are huge in medicine. I mean, there's just acronyms for everything. I could speak in paragraphs that are just acronyms. But yeah, LPCs, liver progenitor cells, and we were talking about the regeneration properties of Frankenstein in the last episode that we talked about, and I kind of went a little bit down the road of it being like a stem cell. So a stem cell is a progenitor cell that can develop into any type of cell based on whatever chemical signatures that cell might respond to. So it could become a blood vessel, it could become skin, it could become brain. And so it was a good theory for how regeneration could occur. So that's what the LPC was, and we will try to make sure we speak scientifically, but also in layperson's terms as much as we can. So with that being taken care of, this episode we put out Jesse put out a question and answer, kind of like call out. And we received messages from people with questions. And some of you even got a limited edition Knife After Death sticker, which Jesse put together for us. So I thank you for that. And
Of
thanks for
course.
your questions. Now, interestingly, it was a year or two ago, I put out a kind of like Q&A of my own on my Instagram because I was starting to do the podcast again, and I said, please give me some ideas. And some folks uh, wrote me with ideas, and then I didn't answer any of them because I stopped doing the podcast for a while. But what I did do, because I'm that kind of guy, I screenshotted the questions, and I actually found the screenshot this evening from 2 years ago. And I have some questions from that were asked to me. And in fact, we're going to open up with one of those questions. This is from Bailey Hall, 2424. And Bailey, I don't know if Bailey's listening, but I believe is or was a medical student, may have graduated already at this point, and always asks good questions. The first question is, why do coroners have to declare a political party? And it's an excellent question because from an outside perspective, you're looking at a death investigation. So what should be political about investigating death? It's science at that point. Well, and without going into a full 2 hour lecture on why coroners exist at all, I'll give you a really brief overview. The coroner comes from, the old English system from hundreds of years ago, where when somebody died, that person's property was the property of the crown or the king. And corona means crown. So coroner was someone of the crown who was sent to go to a person's property if they died and would collect everything to take it back to the kingdom, and it became property of the kingdom. So the coroner back then wasn't necessarily doing like forensic autopsies like we do now. They were more of a legal, and I guess you could say they were a political representative of the king or queen, whatever the case may be. And I think from that, it sort of, passed down, trickled down through the ages that it is a political position. So I will also say that in this country, in the United States, because I know we have listeners from all over the world, which is kind of cool actually. But in the United States, we have two systems of death investigation, the medical examiner system and the coroner system. Now, I will say that there are some states that have a mixed medical examiner and coroner system. And California's got a different, is it a different title for theirs? It's like
It's still
coroner, sheriff,
it's
and
still a
medical.
sheriff coroner system here. Yeah.
Yeah, yeah.
Yeah. So
So, well, the point is, and without having to talk about all 50 states, because everybody's got a little bit of a different take on it. The medical examiner system it is a system through the government of that state that appoints, medical examiners, forensic pathologists, and people who can serve as death investigators. And it's very much a government hired position. Whereas in the coroner state, the coroner is elected to usually per county, and then that coroner will contract with forensic pathologists to do their work. Generally, coroners do not do autopsies, but they do have to declare a political party because they are elected. And the way that I've seen it done is usually because the political party doesn't really matter, it's not going to really change the way you do death investigation. The people that run for coroner usually just pick the party that wins in that county every time, and that's their party. So, yeah, that's pretty much how it's done. Um, and in my state, Indiana, it is a coroner state. So there are 92 counties and there are 92 elected coroners. And then those elected coroners can contract with uh, whatever pathologist they want. Some of them contract with me and some of them contract with other people. But the bottom line is, truly, the political party doesn't really matter other than it's a means to get elected. I mean, if you're in a very Republican county, you're going to run and win as a Republican, and if you're in a very Democrat county, you're going to run as a Democrat and win. So it just kind of descends from the fact that it was a a legal arm of the crown in Europe, in England, basically.
yeah, and it
So
does
yeah, I don't
certainly
know if you have any perspective. Yeah.
yeah, it does certainly feel a little archaic in that regard. And I know like plenty of people have issues with using like a sheriff coroner system. And then it, like Doc said, it varies from state to state. And then there's deputy coroner investigators, which is who I worked with primarily, and those are trained, like we were fortunate to have like trained medical legal death investigators who were
Mhm.
very professional, knew their science, and that's a little bit different. They also did autopsy, and a lot of that had to do with just lack of personnel. So they were trained as DCIs, deputy coroner investigators, and then they
Mhm.
were autopsy technicians as well, and that was the position that I was in.
Mhm. Cool. Yeah, it's interesting. You use the term archaic, and I don't think that people would disagree with that at all. I think the way that it's looked at is the medical examiner systems are more uniform and systematic with how they do things, and the coroner systems are it's an older system where counties operate very differently. I mean, I've worked in my state in multiple, I've probably worked for 30 or 40 of the counties in my state, and every county has a different twist on how they do things and also budgetary concerns. Now, I can't speak with a lot of experience about medical examiner state systems, but I think the money is probably a little more evenly distributed in medical examiner systems versus in the county. I mean, if you live in a county that's only got 12,000 people in it, you're just not going to have access to as much staff and as much money and as much resources as you might living in a county with 1 million people. And so that's the difference. And I do think that that goes back to why is it a political position? Because there is a lot of that kind of political, wrangling where you have to petition, your county commissioners to get more money from the state, and the state determines, how much money you get per county and stuff like that. So yeah, it's kind of an interesting thing. A lot of people don't realize that. There's a lot you could talk about with coroners. We should probably just do a whole episode at some point because a lot of people think coroner and medical examiner and forensic pathologist and mortician are all the same thing, but they're all different. So yeah, maybe that's something we'll do sometime. But with that being said, I think we can move on to the next question. And that, did you want to introduce it, or do you want me to just skip into it?
Oh, I can do that. So this one's from
Yeah.
Romy SB. In the case of autopsy of a pregnant patient, do we autopsy the mother and the fetus?
So this is a very good question too, and this is something that I have this question a lot because I think that people they're a little nervous that we autopsy the baby as well, even though the mother is what died, whether it's in a car accident or homicide or something. And the answer to this question, at least where I work, and it should be the same way throughout the United States, is if a pregnant patient dies, you also have to autopsy the fetus. There's a lot of information that you can gather. Now, this is one of those questions that is an entire episode. It's an entire book chapter. But let me give you at least one example. So we've had multiple cases where a pregnant mom has been murdered. Okay, been shot, been stabbed, something. And of course, you would have to do the autopsy no matter what on that on the mother. But then when it comes to the fetus, you also need to do the autopsy there as well because that gives you a lot of information about viability. It attaches kind of a personhood to the fetus, like was it a boy, was it a girl? These are important things for juries and for trials. And so there might be questions of viability, like was the baby far enough along to survive? Because it could be that in some states, this could be the difference between charging as a homicide or charging as feticide or something, which is kind of a different kind of charge. Um, and I think some of them even just do manslaughter for fetuses. But yeah, so from a legal perspective, with a murder type case, you have to do both. But we also do both, even if it's like a car accident or a natural disease. Um, the mother and the baby are as one. The baby is living off the mother, and there are things that can occur from the baby through the placenta to affect the mother. So we have to know, for instance, let's just say the mother was septic. Um, did the sepsis arise within the amniotic sac and infected fetus? And where did that infection come from? Are there any chromosomal abnormalities of the fetus or the placenta? Are there congenital abnormalities like is it like I said, a chromosomal syndrome, trisomy 13, trisomy 18, trisomy 21, or some other genetic disease? Because all of these things are important to know as they interplay between the mother and the fetus is kind of one health unit, but also separate health units. Also, we always have to remember that there are other people involved. There are maybe other children of that mother, and they need to know the health history. The father of the child. Just it's important to obtain closure for the family, other loved ones. But like I said, medical history and just getting the story right. Better to say if you didn't do the fetus, you are leaving out you're doing a big blank space there that could help you actually determine what happened. If you don't do it, it's like having an algebra equation with, you just have a missing variable. So yeah, we do autopsy both the mother and the fetus. And I will say, thankfully, this is not incredibly common. I only have a couple a year. And thankfully, most of them are just natural. But I have had murders. And Jesse, what's your experience with this? Have you had many of these?
So the vast majority of my experience has been children who were already born. 3 months was the youngest I did an autopsy on.
Mm,
And that one,
okay.
unfortunately, that was due to a combination of neglect and drug abuse, substance abuse, methamphetamine.
Hmm.
But there was a couple we did where I remember tox was super important for both mom and fetus on those cases.
Right.
I will say statistically, murder is the most common cause of death to a pregnant woman. If anybody was
Hmm.
unaware of that, that seems horrible, but that's the truth.
Yeah. Well, I had a run on those where I just couldn't believe what was happening. When I was working in the big city, I felt like most of the pregnant patients I had were murdered. I
Yes.
mean, there was, for whatever reason, that is an absolutely true thing that you said. And I just kind of thought, gosh, is this just regular? Am I going to keep seeing this? And as I moved to other communities and worked in smaller communities, I found the causes of death to be less murder, but more accidental deaths,
Yeah.
car accidents, and things like that, and certainly natural deaths.
Hmm.
You know, and the other thing is I want to say about that is you don't when you have the mother there to do the autopsy, you don't sometimes know the cause of death. And the cause of death you have to have the placenta, you have to have the baby to see if that played a role somehow. Preeclampsia, you have amniotic fluid embolism. That's another big one. In fact, I can remember this is one that scares people a lot. And I don't know if you've ever had an amniotic fluid embolism case, but for some reason, I have had multiple of them, and they are pretty uncommon. I think
I was
it's
gonna say that,
somewhere
yeah.
between, oh yeah, yeah, it's very uncommon. It's like between 1 in 10,000 and 1 in 50,000 pregnancies is an amniotic fluid embolism. They're almost unsurvivable. Very few people ever survive them. And I've had like three of them. And so one year, three or four actually, because one year I had two within like a month of each other. So I think to myself, oh, this will be a good topic to talk about. I'm going to make a TikTok video. And, it was informational. It wasn't me dancing or something. But I made a TikTok video. Yeah, I know. I know. Because I always like to talk about interesting topics that people don't know very much about. And I said, okay, amniotic fluid embolism is going to be a great case to talk about. So I get on there and I talk about this amniotic fluid embolism. And it's just very simple, like Robin's pathology, basic stuff, talking about like, the statistics and what happens. And unfortunately, like I said, almost all the mothers that I've heard about, have died from this. I mean, the mortality's got to be like at least 75% or something. Anyway, long story short, people lost their minds. I mean, I think that video had like 500,000 views in under an hour because people were sharing it and panicking. And so all of these ladies were panicking. They were like, oh my gosh, I'm pregnant. And now I am terrified. Oh my gosh, my sister's pregnant. Now we're all terrified. We're all freaking out. These people were freaking out so much that I actually took the video down. And I have never made another video about amniotic fluid embolism because people were panicking so much. And I get it, because unfortunately, if you have it, if you are having symptoms for it, there's not much you can do. You're kind of it's not going to turn out well probably. And I
Right.
realize that maybe that's not the best thing to talk about. To be like, "Hey, by the way, here's a condition that if you get it, you're in big trouble and there's not much you can do." But yeah, that's one of those things where, and I just happen to have more experience with that than a lot of people. I don't know why I've had so many of them, luck of the draw or whatever. But you can actually see squamous cells from the baby inside of the lung of the mother. And what that does is it triggers a thrombotic reaction. And so they have like tons of clots all at once. And of course, you're going to go into acute respiratory distress and you're going to die, short order, really. I think there have been a few people around my area that survived it, but it's a scary disorder. And so, yeah, anyway, back to the question. The point is, you do have to do both for that. So, with that being said, I think we can probably just move on to the next one, which I believe this is more directed for you, I think.
Oh, okay. Let me see.
Yeah.
This is from Marin Duncan. What are the wages like as an autopsy tech? Can one make a living? This one is actually, I have so many thoughts on this because anytime that you're
Yeah.
a lower level medical professional, so medical assistant, um, autopsy technician, those are just two that I've been in. It kind of just depends on the generosity of the company that's hiring you, to be honest with you. But typically, no, I would say that neither of those positions are ones that you can make a living off of, at least where I'm from. I live in Northern California. Um, and then honestly, like I've applied for autopsy technician positions in bigger cities like Los Angeles, and the wage does go up, but the cost of living negates that. So to me,
Mhm.
being an autopsy technician is, even though I love it, it's more of a stepping stool to try to get to, a place of higher education, even though I think that, just being I using air quotes, just being an autopsy technician is fine. I love it. I love autopsy. So, when I got my internship position, and be tenacious, like people that work in death, I don't think that they have a lot of people like kicking down their door to come do that job. So a lot of what we do, especially when we're just starting out, I don't know what your experience is, Doc, but I basically I kept going into the coroner's office every single day, just asking like if there was an opening, and eventually there was, and the lieutenant called me and he was like, "Hey, come in for an interview. I know you know where the office is." And so that's how I got that position, and it worked out really well. It's just at that point it was an internship. Um, and nationwide, we don't really like to fund death because it's icky. So when it came time for them to actually put up
Yeah.
a salary that I could be hired on, the county kept putting up fights, even if they changed the designation, even if they were going to hire me on as a cadet and then use me as an autopsy technician only. They still put up fights with that. So eventually, that's how I ended up as a medical assistant. I had to go work primary care because if I could work for free, I would have stayed and just done autopsy. But that's not a reality. We all
Yeah.
labor is brutalized in this country. So
I would agree that, and it is certainly a very important position, and it's one of those that it depends. And I'm in Indiana, mind you. It depends where you work.
mhm.
There are some full-time autopsy techs in my state, And I don't know what they make because I don't ask people what kind of money they make, but I mean, they do it full time and they make a living. So, you know, if you get in with a practice that has a lot of volume, a number of cases,
Hmm.
certainly more than, let's say, 300 cases a year, 300 autopsies a year, and you are the main autopsy tech, yeah, you could make a living. Now, I don't think you're going to go buy a Porsche or have a mansion or anything, but I mean, you can definitely make a living.
Hmm.
Probably, which I know it's different in California, the money stuff, but here you
Yeah.
could make 40 or 50,000 and you could make that would be okay here. But I know that there's at least one autopsy or maybe two autopsy techs around here that make pretty close to six figures or more than six figures because they're so busy. And the other factor is this. Most places will pay per hour, right? But some pay per case. And
Which
if
is
you pay
good.
per case, well, think about it. If you're doing 500 cases and the tech is getting $200 a case, that's $100,000. So, and that is probably about what people make per case. Sometimes it depends on experience as well. So if
Hmm.
somebody starts with me and they have no experience whatsoever, it might be like $50 a case or something, and then it just goes up after that. And so somebody who's supremely experienced and very quick and stuff like that, it's going to be over 200 per case. So you can see how it can add up. But yeah, it's very heterogeneous across the country. You've got high volume areas, low volume areas, per hour areas, per diem areas, and then of course per case. Per case is going to be the best way. So the odds of being able to make a living, I would say, are fairly low, but they do exist. Those
Yes.
jobs do exist. Um, and like a lot of people might do autopsy a few days a week or at certain times of the week, but work a second job. And I think that's the most common thing that I see is that it's more of a second job type thing, which is also why it's been hard for me to find kind of like a full-time autopsy tech because I I am a very unusual person. I'm a very unusual forensic pathologist because I don't have a very set schedule. I go when the case comes in, I am ready to go do it, either that day or the next morning. And not everybody can arrange their schedule to work with me. So that's why I've taken to just doing the cases myself because it's just too hard to have somebody like line up. Okay, can we line up a time tomorrow between 1 and 1:45, and we have to be out by 3 because I got to drive to go do this one. So it's just like you said, be tenacious, call your offices around where you live, see if they need help, and you might find a position there. You might, because I think this person, if I read the thing correctly, they've done autopsies. They've
Yes.
done autopsies
Hmm.
before, I think. So they have
As a
some
volunteer.
experience. And yeah, if
Mhm.
you have experience, that's much better because, and I would love to talk about this more at some time, but I have done well over 3,000 myself with an assistant and also without an assistant. And it's difficult. It's a difficult job. And you
It's
feel
very
like you
labor
really
intensive. Yeah.
very labor intensive, but you also have to be very skilled with your hands. You got to be, careful and skilled and thoughtful and forward thinking when you do this job. So it's very mentally demanding, and also we haven't even touched the psychology of it because obviously you're seeing horrible things, which will bring me to my next question in just a moment. But you've got the physical demands and then you've got the psychological demands of this career because a lot of people watch TV, they watch forensic files and they think, oh, every patient's an adult, um, who got murdered. But you also see very sad cases, accidental chokings of toddlers, I mean, stuff that where people should not die. You see, lots of suicides, and a lot of people can't handle that. Um, and and I'll go into the next question here, actually, which is from David Brown, who David has followed my stuff for a long time, and he's always very interested. He posed a few questions to us. David, asked, "What is the youngest person I've autopsied and what was the cause and manner?" Okay, so that question for me is, I get that question a lot. What's the youngest person I've autopsied? Well, the thing is, when you're a forensic pathologist or just a hospital autopsy pathologist, you're going to have to do fetuses. Any fetus that's over like 15 weeks old, 15 or 20 weeks gestation, rather, gets sent to the pathologist for autopsy. So what's the youngest fetus I've ever done an autopsy on? I mean, probably like 13 or 14 weeks. I mean, honestly, gestation, not age, not post-birth, but gestation. So, how many fetal cases do I do, stillbirths and things like that? I mean, gosh, 10 or 15% of my cases, actually, because I'm also, not only do I do forensics, but I do hospital autopsy. I cover two of the largest hospital systems in central Indiana, and a lot of their cases are come from labor and delivery. So, yeah, I mean, and in terms of cause and manner, um, that can vary widely because with fetuses, with stillbirths, very often the cause and manner is unknown. The fetus dies in utero. We do the full autopsy, we do genetics, we do histology, et cetera, et cetera. And we just can't find why they died. I'd say my statistics for fetal has been somewhere between 20 and 30% of those cases I will actually find a cause of death. And most commonly, it's something like acute chorioamnionitis resulting in neonatal pneumonia. So they get like a pneumonia, they have like a respiratory distress, and they die. Other times it'll be something like a nuchal cord, which is the umbilical cord within the amniotic sac that wraps around the fetus's neck, the baby's neck, and it becomes tight, and then it
Super
just cuts
common.
off the circulation. That's another common one. Yeah, unfortunately, I remember being in residency and just thinking, oh my gosh, that is just so scary to even think about a pregnancy because, this nuchal cord is going to happen. Um, and so, this is that is such a common case for me. I can't even, put a quantification on it for how many of those I've done. But if your question is, what is the youngest person I've autopsied after birth? Well, I mean, there again, you've got babies that are born prematurely. They live another 6 weeks and then they die. I mean, complications of prematurity there. Um, but I would also say if I had to really strain my brain to think about it, I can think of one. I had one unexpected death of a about 14-day-old baby, which was presumably healthy. And I will tell you the story here. It's a short story. In this case, the mother had the baby just like normal, went home, apparently not any complications. And one day the mother left. I think there was a toddler brother or sister, and just, oh, we're going to go to the library or we're going to go to the store or something. Put the newborn baby into a carrier, to a car seat, and went out, did their thing, got home, and she noticed that the baby hadn't really made much noise and it was time for him to eat and he hadn't cried or anything. Well, she opens up the carrier and she finds that he's unresponsive, he's not breathing, and calls 911, and unfortunately is unable to be revived. Otherwise I wouldn't be talking about the case because it's going to come to me. So I do the autopsy. I have no idea if this is is it a case where the belt on the car seat has gotten around the baby's neck. I mean, that's the first thing I thought of because you're thinking healthy baby dies in car seat. Oh no, is this one of those things? And I have had those before, by the way, but that's not the case. And this is why we do autopsy. So I do the case. And what I find is this kid, this little baby, had a very large ventricular septal defect in the heart. And that had caused acute heart failure. The pericardial sac was full of pericardial fluid, and the lungs were heavy from heart failure. So unfortunately, this baby had a heart defect that was unknown to the family and to the doctor. And then the child died of acute heart failure. So that's probably the youngest, and that would, of course, would be, um, complications of ventricular septal defect. And then the manner, of course, would be natural. So that would probably be the youngest one I've done that was an unexpected. And then when you look at the time frame between birth and let's say 9 months, 12 months, far and away the most common is co-sleeping. We call that positional asphyxia, and we call that an accident. I don't know how common it is where you are, Jesse, in California, but in Indiana, positional asphyxia, I would do at least three or four of those cases every 6 months or so. Yeah.
Yeah, very, very
Do you
common.
see a lot of those? Did you see a
Very
lot of those
common.
out there?
Yeah. The youngest that I had, that was, this one will make a lot of people mad, but it's just, I feel like it's a good just reality check for some people because you will see this stuff, especially if you do forensic autopsies specifically. So the youngest was 3 months for me, non-fetus. Um, and the mom was a heroin addict. She was doing heroin as she was breastfeeding. The
Mm,
baby dropped from her breast and got pinned between her leg and the couch and suffocated.
hmm
And actually, they had transported the child originally to the hospital, and that's where we normally we don't like that. We like to be able to document a scene as best we can without anything being untouched, but
hmm
occasionally, due to like revival, trying to revive somebody, they will, you know, transport to the hospital. So we went to the hospital. The nurse thought that that pattern, weirdly enough, on the infant was modeling, which was a good teaching moment because it
hmm
wasn't. What that was lividity, and it was the imprint of the couch.
Oh yeah. hmm Yeah, and just as and this is actually a very good point because I know that I have death investigators that listen to this podcast, deputy coroners, people who want to go
Mhm.
into the field. Always pay attention to the lividity pattern at the scene.
Yes.
If
Yes.
if the baby's transported or not transported, take photos immediately because that lividity pattern will change once the baby is put into a body bag. And this actually goes not just for babies, but for anybody. Always get the lividity pattern at the scene because we've had cases that were, I won't say determined, but heavily influenced by what was seen at the scene. So, for instance, the face being white and then the back of the head being purple, because the face was pressed down into something. Usually, it's something like a parent has rolled over onto the baby and it's pressed the blood out of their face. And so they have like a white area around their nose and mouth. We call that contact pallor. That's the actual forensic term for that. So those are very important. And also, for death investigators who are listening, the pattern of the fabric. Sometimes you can see the pattern of the fabric on the infant. I had one case like that where the couch, it was similar to your case.
Hmm.
I think drugs were involved in that case as well. And the pattern of the fabric was almost like a corduroy fabric, like corduroy pants or whatever,
Right.
and it matched perfectly to the pictures they took at the scene, which when I saw the baby, the next day when I did the case, it was not as prominent. So always remember, future investigators or current investigators, that you definitely want to get those photos as early as you can because the pathologist needs to see those photos and it can be helpful in determining things like positional asphyxia. Now that seems obvious, right? But there's a lot of cases that got called SIDS that were probably positional asphyxia. And so, that's the kind of quality of evidence that we need to call that. Because let's face it, a lot of people who do roll over on babies, they are obviously sodden with guilt, and they sometimes don't want to say, well, that's what happened, because that could implicate them, particularly if they are using substances or drunk or something like that. Then that's going to be, a potential legal issue. So that's why getting the evidence yourself Certainly witness interviews are good, but you also have to look for the evidence yourself. You can't just rely on the testimony of people at the scene. It is
Working the
important.
scene
You
is
got to get
very
both.
important. Yeah.
But yeah.
Yeah. And working the scene
Well, and
especially.
actually,
Sorry, go ahead.
mhm. No. I just really quickly, I was going to say one of the questions I got was to talk about death investigation on the death investigation, not that I do, but that the investigators do. And I actually used to teach one of those classes. So I did not answer that question for this podcast because I feel like it's its own podcast. So
Right.
we are going to talk a little bit about death investigation. Anyway, go ahead.
Yeah, I just wanted to say, work your scene, command your scene, by the way, because you do have, unfortunate circumstances in which I feel like not all of them, but some police officers will try to kind of like bully you and push you around to get things cleaned up quickly or move on quickly. And that's not what we're here to do. We're here to collect evidence and make sure that,
Yeah.
that can be used in court if it needs to, whatever comes of that, and just be documented appropriately. But also, just I think that goes into like one of the next questions, which was about forensic photography. But whereas artistic photography, like when you're showing somebody like something conceptualized through your eyes to have like an artistic bent, I've done that kind of photography and it's wonderful and it's beautiful. But through your eyes in forensic photography means pluck my eyes out, put them in your skull, and show me exactly like your not just perception, but you like take me with you, put me in that exact
Mhm.
place with you, what it looked like as you walked the scene, those kinds of things. So it's a completely different set of rules when it comes to forensic photography for documentation purposes rather than artistic, although both are fun.
Yeah. Well, actually, and on that note, I wanted to say that we are going to talk about there were some questions on forensic photography, and we had a number of questions that we are not going to put all in this podcast. We will be pushing some of them to another. We're going to have a part one and a part two Q&A. We've got one more question we're going to answer in this particular podcast, and then in the next one we will answer some of the other questions we were just talking about with the forensic photography and some other things. So, and also I wanted to say that we are paraphrasing the questions. These are not word for word necessarily from the person. We want to make sure we get that right. So if you listen to it and you say, that's not exactly what I said, it's because we're just paraphrasing a little bit. So, but yeah, with that being said, we could talk about that a lot. I love that death investigation stuff.
Me too.
Um, and maybe, actually, I may be trying to figure out how to teach that online so that you guys can come and watch those maybe at YouTube or something. By the way, my YouTube's Knife After Death, just like this podcast. We'll do more of that social stuff toward the end. Now, we do have one more question here I wanted to talk about. And this one is from Ariel S. Okay. And this one is, what's the worst TV show when it comes to forensic accuracy? And let me first say that I think the better question is which one is actually any good because all of them get a lot of it wrong. Um, Now, I will say that I am not a huge consumer of fictional forensic content when it comes to TV shows or movies. And a lot of people are surprised by that. They think, well, gosh, Dr. Wolfe, you're a forensic pathologist. Aren't you just studying this stuff all the time? And the answer to that question is because I live it and I've been living it for a decade, and I see the horrors of humanity on a daily basis. When I go home to watch, and I watch TV or movies, I usually try to not watch those things, but invariably, people sometimes will send me clips or they'll tell me to watch movie X or movie Y, and I do get a kick out of it, really. In fact, to the point where I see so much that's wrong, not only with forensic shows, but with medical shows. I was like, my goodness, should I start like a forensic consulting for Hollywood type business? Because I love that stuff and I love accuracy. And unfortunately, a lot of it is sensationalized. Now, I do have one show that I really sort of, was it kind of spurred me to even write a book. But I would rather hear, Jesse, do you have any comments on worst show or movie when it comes to forensic stuff that bothers you?
I think all of us in this industry hate CSI because of the effect it has on juries. They literally call it
Yeah,
CSI syndrome. And it's kind of poisoned jury boxes across America to think that they know how it works. Um, you know, again, people don't like to fund death in this country because it's icky. So we do not have, state of the art, technology to help us do certain things. So it's just a lot of it's like we could use the word
yeah.
archaic again. A lot of it's like older technology, those kinds of things. A lot of it is just us,
Hmm.
talking to each other because certain counties don't share, you know, murder information, which seems insane to me. But I mean, that's true. They don't
Yeah.
share that information with each other, even if there's somebody, for instance, like, a serial killer at large. You know what I mean? So
Yeah.
it's not.
Well, yeah, I mean CSI, I'm glad you mentioned that. The CSI, because there's like three or four different franchises for that now, like
Mhm.
CSI Miami and CSI this and CSI that. And I think NCIS is another one, but it's actually really important because not only juries, but families of the decedents, they think that you can just, would just swab and send for DNA and find out who the murderer is a half hour later. It doesn't happen that way. And so we have to educate. I know the office is interfacing with the families all the time. And sometimes, we just have to say, that's just not how it's done. And what I do, because I used to go to court a lot, I got so caught up on my homicide cases that I actually haven't been to court in months, probably. But I was going every week, every couple of weeks for a long time, and I got pretty good at it. And I got to the point where I did preempt the jury. I would tell them, now you may be familiar with how it looks in TV, but that's not reality. And let me explain what the reality is. And they really appreciated that. I think the attorneys actually appreciated it too, because I have to basically do a little forensic seminar on whatever topic, whether it's a stabbing or a gunshot wound or a strangulation or something like that. I have to prime the jury in short order, and so I have to be like, dispel with everything that you think you know, and now I'm going to tell you the reality.
Yeah,
And
exactly.
it's been great, and I would tell people who are going to go testify to do that. Make sure you understand that the people sitting in the jury are not physicians, generally, certainly not the majority. They're not lawyers. They're regular people from the community who may only have a partial high school education. And that's not to demean them in any way. That's just how their life is, and they don't have a lot of science background. So you have to teach that. Now, to be more specific, because the question was specifically, now we talked about CSI. I had to mention it. And now, don't get me wrong here. I like this show. I do like this show, but Walking Dead, the forensics was so bad in Walking Dead that it actually caused me to write a book. And that book, by the way, if you want to buy it, is called The Handbook of Zombie Forensics and Medicine. And it's basically a book about the forensic elements of not only what would cause the zombie disease, but how to kill a zombie. And so, and of course, the sort of infection control elements of killing a zombie. Like, for instance, if it's a truly infectious organism, you would not want to discharge a shotgun at close range to the head of a zombie because then you're going to be sprayed with whatever the infectious organism is. That's always bothered me. But but also things like, yeah, I know you're laughing there. I think about this way too much. I used to sit in my office in the hospital, and I thought of this entire book, and then I finally wrote it. But the one
I'll
that
link it
kills
in the
me,
show notes.
yeah, yes, link it in the show notes because it's going to be a great gift for the holiday season. Um, the one that bothers me the most about The Walking Dead is when they quote kill the zombie using a knife. And what do they do? They go up to like the temporal region, and then they just sort of push it in, like, and I'm thinking, the temporal bone is a thin bone, but you have to put some force behind it to crack that bone, which A is going to increase your risk of injury to your own hand, thereby infecting yourself and causing you to be a zombie. And number two, if you do get that knife into the skull, then what? You're going to go into some mushy, rotted brain? Well, what's that going to do? So in the
For people
temporal
that
region,
don't
you know
know
what I mean?
anything about decomposition when it comes to the brain specifically, a decomposed brain is liquid. It's not like
Yeah.
soft and gushy, it's liquid.
Yeah, it is certainly as you see the decomposing zombies, they would not really have a brain. That's the other thing is when they get shot, they bleed. And I'm like, now wait a second, how are they bleeding when the blood is technically after you die, it's going to be decomposing. The blood, by the way, folks, the blood decomposes after you die. It's one of the first thing that happens is the blood actually diffuses into the tissue and it causes an appearance that we see called vascular marbling, where the blood vessels in the subcutaneous tissue form a marbling pattern on the body. We're going to do some decomposition episodes, and we'll actually show some examples of this. It's going to be really cool. But yeah, when I think about one of the things I was thinking about is, well, now wait a second. If these zombies are dead, that means they're not respirating. And if they're not respirating, they're not taking in oxygen. And if they're not taking in oxygen, then they can't undergo oxidative phosphorylation. And if they can't undergo oxidative phosphorylation, that means they can't produce ATP. So if they can't produce ATP, then how are they moving? How are they running? Et cetera, et cetera. So that's the kind of thing that my mind goes to is the zombie stuff. Anything with zombie, I have not seen anything that satisfies me, which is why I really need to do another follow up to that book, honestly. But yeah, if there are any zombie show people watching and you want me to be a consultant for your show, I would love to have an IMDb entry. So that would be great.
Also, just the
Uh,
idea that do they think that bone decomposes because like the way that they just like you said that bone is a thinner bone, but you still have to pretty aggressively, you know, basically blunt force to get an object into there and then it's going to get stuck and I don't the
well,
thought process behind it was quite silly.
Well, in my book, I suggest that going in through the eye is actually the best way because
Right.
the bone of the orbit, the bone of the orbit is actually as thin as an eggshell. And so now that's the way. If you want to actually kill a zombie, you got to go in through the head. You can't go through the back of the head or the top or the side
It
because the
would still
skull's
get
too
it
thick.
would still get stuck in the zygomatics though, wouldn't it? Like around that you'd run that risk still.
Well, yeah, possibly. I mean, I'm just thinking if you go back through the optic canal, crack it in there, and
Hmm.
you've got a long enough blade, you can go right into that liquid brain tissue that's not going to do anything.
Right, the brain
So,
that's not
yeah.
there.
I really think I really want to. I wish I could write a fictional account of sort of a zombie apocalypse where they have to deal with these issues, where they have to actually say, well, wait a second, now the brain is liquid, so just stabbing them in the head, shooting them in the head's not going to do anything.
Could we
We got
make
to
a
do something
silent film
more.
together that's just nothing but those complications?
I mean, I think it would be great.
It would be
I think it would be
hilarious.
it would be a great comedy. Yeah, I mean, not since Shaun of the Dead has there been a great comedy zombie movie. So, definitely I'm thinking about it. Anything else on that topic, Jesse?
No, I think the only two shows that I will kind of give a shout out to, and it's not specifically for, you know, accuracy. I do like just from a criminology perspective and victimology perspective. Somebody actually asked me this, and it wasn't necessarily for this episode, but they were saying, you know, I think the term victimology is misrepresented because it doesn't mean that you're studying a victim to somehow place blame upon them for the crime that they suffered. You're studying
Hmm.
them because they are a mirror to their offender. And that's kind of what Mindhunter was. And I love
Okay.
Mindhunter as a show because it's I'm sure some of it's embellished a little bit, obviously, for entertainment, but those
Mhm.
are real perpetrators, real offenders who
Mhm.
laid the groundwork for the behavioral science unit, which is now the behavioral analysis unit. But
Mhm.
that's a little easier to do because, you can actually talk to prosecutors that worked, profiles that worked those cases. And I feel like that's a really good one in terms of like if that's something that you're interested in, because they do get into the nitty gritty of it enough to where you can kind of get a feel for the horrors that you will be subjected to if you choose to study humans like this. And it's very
Mhm.
interesting too if you just like psychology. So there's that one. Bones, I give somewhat of a pass to because it was written by a forensic anthropologist. I don't know how much control she had over like the writing and the show itself. Some of it can be quite cringy. However, it is like a soft core, like I use to kind of, I
Yeah.
showed it to my little sister, and now she wants to go into like ballistics, which
Oh,
I'm thrilled with. But it is a
yeah.
good, I think it is a good show just in the sense that it does show some level of like the collaborativeness you have to be able to solve crimes. Like it's not just one person
Right.
doing it. So in that regard, I think that's a good show.
Well, my homework is going to be I'm going to watch these that you've mentioned and some of these others that I haven't seen. And I think for future episode fodder, we can actually go through some of these shows and movies and talk about, what we liked or didn't like about them.
Yeah, I would
I
love to
think
talk
that
about
would actually
Mindhunter.
be yeah, yeah. Well, if I get some time, I'll definitely check it out. Well, thanks for your input on that. I know that I'm sort of a little bit of a curmudgeon when I'm watching anything with forensic in it. I'm like, oh, come
I can
on.
be
They
too,
did
for
need,
sure.
I do. I imagine anybody that's sitting with me watching is like, dude, you just need to calm down. It's not that big of a deal. But I'm such a stickler for detail that what was that movie we reviewed? We talked about, was it Reanimator?
Yes.
In the podcast that
Hmm.
we did
Hmm.
before on your podcast
Yeah.
from a few years ago. Now they clearly those folks had asked a forensic pathologist. You need to review these scenes because they were dead on the
Those
color and
opening
the
scenes of that dead body,
yeah
and I know that you said it
yeah
too, we were both convinced for a few minutes that that was a dead person. I
yeah
legitimate, like the
exactly
lividity, like the livor mortis was so perfect, that coloring,
yeah.
like I was just like that is a dead body.
It was so good. It was so good. And that is a movie from what, 85,
Yeah,
84,
in the
something like
80s.
that. So
Hmm.
people, they got it right, back then. But one thing I always kind of wanted to do was to go back and watch like Quincy episodes you remember from the 1970s,
I
Quincy?
like Quincy.
I used to watch it a little bit, like when my grandma used to watch that out, and I used to go to her house and I would sit there and I had no idea what it was about. But now I do that job. I would love to go back and see like 50 years in the past, like how accurate were they? We might do some episodes now and then. Jesse and I are interested in entertainment type stuff, so we're going to have a little bit more of an entertainment bent on some of these podcasts.
I am
But
forever
at any
heartbroken that
rate,
Quincy and Columbo never had a crossover episode.
a crossover episode, yeah, that would have been a good one, wouldn't
I
it?
would have loved that.
Um, So with that being said, we wanted to kind of do a little bit of a shorter episode because we're going to have to split the Q&A into two episodes. And so this is episode one. If you didn't have your question read, don't worry, we're going to get around to it for episode two. And but thanks for listening. And please, as always, go ahead and send us questions, comments, or concerns. And a reminder on social media, Knife After Death at YouTube, The Dead Letter at TikTok, Instagram, and Facebook. And then we also have an Instagram for Knife After Death where we've been getting questions there. And also Jesse will put up some images if they are pertinent to some of the things that we've talked about for our episodes. So always go check there, follow there, tell your family and friends, and we'll keep going. We're gonna have more giveaways too, so stay tuned for that. Anything else, Jesse?
I think that's it for this episode. This one was pretty simple.
Okay.
Mhm.
Fantastic then. Well, then we'll just wrap it up and we will talk to you next time. Thank you.
Say, did you ever hear the saxophone let out an awful moan, let out